I just want to start off by saying, as a father, I have two sons in higher ed and a daughter in middle school. It's been a very different year, obviously. I actually sponsored legislation to give $500 million for mental health for schools, and Mr. Portantino's bill was the lead bill that came out, but I was happy to support that. So I want to just share, I think one of there's no lack of resources. We have tons of resources in California right now, and that's a great opportunity for us to expend those resources. But I think a couple of things I want to look at here is availability of people to actually do the work, representing very rural districts throughout the state, and getting the money out and actually finding the clinicians. I'd like you to maybe touch on that a little bit. And then I was wondering, after this many months of being in the pandemic, one of the things I observed as a parent and also listening to my districts is consistency in policy. So I think Senator Glazer kind of touched on that a little bit, how do we measure, what do we see as far as moving forward? So if you could touch on those, and then the last question would be, how do you see it being implemented in those areas that are very rural? So those are the three kind of top questions I had.
I'll let the panelists decide who goes first.
There are some.
Dahle, I wanted to acknowledge that in the rural areas that our families are dealing with many things. In addition to COVID, we're also dealing with fires, and just want to acknowledge that we've had whole communities destroyed, schools lost, and lost loved ones. And so as we think about mental health supports, in addition to COVID, we have to provide wraparound supports for our families impacted by natural disaster. And you're right, the workforce has been impacted. You mentioned county superintendents. Our county superintendents have been incredible in standing up ways to grow the workforce, and Superintendent Gordon talked about it. And our Solano County Superintendent, Dr. Harrington, Sonoma County Superintendent, Dr. Harrington, has, out of experience and necessity, built a way to help get more counselors to areas, especially when they've been impacted by natural disaster. And we have to learn from that and build from that and build the workforce programs so to help us get more clinicians in the areas where there are fewer access points to healthcare and to mental health. And so we're committed. This is also an issue we have to deal with in terms of, we have teacher shortages. We have so many superintendents across the country who are retiring. The fatigue level of educators and mental health professionals is so significant that part of our calculus in this moment has to be about how we support our existing clinicians. And you're going to hear from a great association of school psychologists and counselors later today. I won't take away their points, but we have great associations for clinicians. We have to support them. We have to support interns, students who are in graduate programs to become clinicians, and really put the incentives in place to help them not only become clinicians, but also to come to some of the communities that have the highest needs. And obviously, we're happy to work with you, Senator Dahle, on ways that we can be supportive. I just wanted to acknowledge all of our families that have been impacted by these fires, and thank all of our county superintendents who are helping them. We've also raised money to support those families that need additional resources and supports. And we stand committed to working with these panelists and with our county superintendents and other leaders on how we grow our workforce to have more clinicians all across the state.
So could I just be very direct? Every business that I know, including my own, is having a hard time finding people to work. And so are you having a direct shortage of filling these positions? Are they available? Are the people available?
To your question, Senator, I think that in areas that have had barriers to healthcare and don't have a lot of healthcare providers, we have seen historically that there have been challenges. And before the end of this hearing, I can get you any statistic that's available about shortages around mental health. I think Superintendent Gordon alluded to it in his opening remarks. But we have found that our county superintendents have really been creative in coming up with some, I would say, short-term measures and long-term measures to address shortages. And I would just mention Fresno County Office of Education, for example, has been able to fill hundreds of counseling positions in recent times. And so there are examples of places where we've been able to meet the need, but I think that we should anticipate that this sector, like every other sector in our workforce, will be impacted, and we'll need to do planning and strategizing now to figure out how to provide short-term needs and to build the long-term workforce that we will need going forward.
Thank you for the direct answer. I appreciate that. I know it's a challenge, and I'll just close by saying, I want to just give maybe the rest of the members some of the challenges that are faced in rural areas. If you're in Happy Camp, which is typically, it's on the Klamath River, it's in my district, it's Native American. Highest suicide rate of young men is Native American, 19 to 25 years old. To get there is from Siskiyou County Office of Education is about a 2.5-hour trip. So if you send your clinician out to observe, they're 5 hours on the road each way before they even get to observe the students. And so those are the challenges that are faced with throughout at least northeastern California. I know Senator McGuire's district as well. And so those are the challenges, and plus being able to even find those folks to start with. So appreciate those comments, and I'll be looking forward to working with our superintendents in our local districts and you all as well as trying to find those folks to get out there and actually do the work that we need to do desperately for these young people.